in addition to Dadaab refugee camps, thousands of displaced citizens are on the move around the world daily because of violence and food scarcity and other reasons. And health experts are concerned that not enough is being done to address the impact of displacement on their mental health. 2010 report by the United Nations Refugee Agency, UNHCR, says that more than 40 million people worldwide are refugees, and the number is growing. 80% of them are in developing countries. In Africa, there are ongoing conflicts in Somalia, the Democratic Republic of Congo, Sudan, and more recently, Ivory Coast and Libya. The growing crisis is visible at Dadaab, which has exceeded its 90,000 person capacity. It now holds closer to 400,000 people. The numbers are overburdening donors.
What we have seen in the way of shortages in the food pipeline in a number of these areas. This is leading to real suffering. All of these people live on the edge in any case, and this perfect storm is tipping them over into really acute and severe needs.
Some refugees walk for days, searching for shelter, food and security. Carrying only their most prized possessions, refugees may be displaced for short periods or for years. This year alone, refugees came from unlikely places such as Ivory Coast, Egypt, Tunisia, Libya and other places. Help comes in the form of food and shelter, but health experts stress the importance of providing peace of mind.
Mental health is neglected, underplayed in Africa, yet it is a big subject, particularly in relation to the wars that have affected the continent, and also related to new ways of living in towns and not in rural areas.
Asylum seekers are also adding to the pool of refugees, which grew by nearly 1 million last year. South Africa, with 222,000 new claims, makes it the largest asylum destination in the world. Many find themselves living like destitutes and subject to violence or xenophobic attacks. And many refugees don't receive counseling or mental health services because host countries are burdened by their own problems.
In a country that is coming out of war and where, for instance, the whole health of women and children is extremely low, even the mortality, as you would read from papers, is still very high. We're still talking of a maternal mortality rate that is over 800. And we're talking of child under 5 that is over 140. Therefore, if you have to prioritize them, then of course, quite often, there is a very high chance, and this is in fact a reality, that mental health has not received the sort of prioritization.